The Thyroid Trust is now entering our 4th year of operation and our 2nd year of being a UK registered charity. So at this stage, we're really reviewing what we've achieved so far and planning our strategy for moving forward. And that includes developing new mission and vision statements, which are currently in draft form and look like this. Our mission is to make things better for thyroid patients by improving access to quality peer support and reliable information, improving understanding, raising the profile, and advocating for better treatment for thyroid conditions, addressing the issues of most importance to patients. Our vision is to be a powerful voice and resource for thyroid patients, led by patients, working closely with the medical profession, providing services and advocacy, as well as conducting and influencing research in line with leading charities for other common health conditions. So we've made quite a lot of progress, even in the short time that we've been going so far. Over the last year, we've done quite a bit. We were key stakeholders in the development of the new NICE guideline for thyroid disease assessment and management, and we managed to have quite a lot of influence on the final document. We were also able to influence the British Medical Journal to edit an article which they published about the guidelines, which was a little bit unclear about what the guidelines has to say about liothyronine prescribing. So we were very pleased to have achieved that. And then we work with a number of partners, and partnership working is very, very important to us. So with our partners, we published a T3 prescribing survey in February 2020, showing what was happening around the country with prescribing of liothyronine. And off the back of that, we were able to organise quite a high-level meeting on liothyronine prescribing with NHS England, Healthwatch England, the British Thyroid Association, Professor Chatterjee at the time, interested parliamentarians, Lord Hunt and Lord Borwick, and patient representatives. And we got some assurances from NHS England at that meeting, confirming that the national guidance, which says that liothyronine should be prescribed to those patients who require liothyronine on the NHS, that would be reiterated to clinical commissioning groups. We've achieved quite a bit of coverage in national, regional and local media, helping to raise awareness of thyroid disease. And we've been very lucky to receive funding from the National Lottery, including emergency funding of £15,000 to keep going through the pandemic. And we're using that money not just to continue with our events programme, which is very important, but also to build our team, strengthen our processes and widen our networks, and to develop our organisational learning, all of which is really important so that we can do more in the future. We've actually organised 9 events over the last 12 months, both with clinician and patient speakers. So we've had some fascinating talks from Professor Margaret Raymond and Dr. Sarah Bath, Dr. Christian Bolart, Professor Atul Kalhan, and Dr. Rennie Honderkamp, as well as 2 fascinating patient speaker talks on aspects of self-care. We've had amazing support from Transport for London, both with meeting space, with information sharing, and one of their train drivers actually just ran a marathon for us, which is amazing. We've done some really fun awareness raising activity using the butterfly as our theme, because so many people just don't even know that the thyroid is a butterfly shaped gland. So we really want to sort of raise awareness of that and have a bit of fun with it, which we have been doing. And we were covered in both the Daily Express and BBC Radio Kent with our butterfly runners and cyclists. And around Thyroid Cancer Awareness Month, which is just gone, we held our first ever online thyroid cafe, and a volunteer also organised with an artist an amazing exhibition with origami butterflies in beautiful boxes, which she managed to persuade the British Museum to donate. Again, all raising awareness of the butterfly gland, we think is really important, really worthwhile. So we're absolutely determined to do more in the future, and this is our progress report for the last year. Thank you.